And we're back. Welcome back. 94.7 The Pulse. You're with Loretta on Loretta's front page. And we've been talking in this second hour about function and how our body is supposed to function and how we can have this beautiful ease and freedom and independence and all these gorgeous things. And I'm welcoming Lauren Earls to our conversation. She's a women's physiotherapist and co-founder at Physio Pod Co. in Leopold and in Newtown. Lauren, welcome.
Thanks, Loretta. Thanks for having me.
It's so good to have you. I do have to confess, I face stalked and website stalked Lauren, and I was like, can you come? Can you come? Can you come and talk with us on the radio? Because I think what you do is really important, and the area of the body that you focus on with women's health in physiotherapy is really, really important. So thank you for coming in and not, blocking me.
Yeah, no worries. Thanks for touching base and having me on.
Now, I know you've got a big background in supporting all people with their bodies, and you've worked with the luge team with the Winter Games. Is that right?
Yeah, the skeleton team. So where they go head first down a bobsled track, which is a bit crazy.
That is more than crazy. That's like okay, and
insane.
Yeah, they're totally insane. And you're so supporting elite athletes, but I know that you have a real passion for supporting women to have the best health that they can.
Yes.
And today we're gonna delve into the pelvis.
Yeah, let's do it.
Is that a place that you feel really comfortable?
Oh, totally. Yeah, it's my jam. It's what I do every day. So there's a lot going on between the bones of our pelvis. So yeah, it's a great thing to be talking about.
I said right at the start of the show at 9 o'clock when I was saying that you were going to be coming in, we're going to be having this chat, and I'm really glad Larissa is here as well, sitting in her naturopathy and conditioning coach space. The pelvis is a mysterious area. Mm-hmm. Like for a start, I think that, we have an idea of the different parts of our body, but it's almost like there's mystery and there's taboo in and around this pelvic region. Do you see that a lot with the clients that you're talking to? Are they well informed about actually what's even there?
Yeah, I think it's changing. I think now with radio stations like yourself and social media that the conversation is happening more now. But definitely, like a lot of what I see are taboo topics that weren't addressed or common knowledge, I guess, in the past. So things like painful periods where people have been taught that that's a normal thing, and it's not. It's not a normal thing at all, and it can be addressed and treated. The same with incontinence and prolapse. They're a big area of what I see and I treat. But yeah, for people to know that these things are common, particularly after, say, having a baby, but they're not a normal thing, and that they can be treated and addressed, and you don't have to be putting up with it for the rest of your life.
Yeah, for sure. And before those people who think, whoa, this is all a bit, I don't know if I can listen to this conversation about the pelvis, before you switch off or decide this conversation isn't for you, let me just have a chat about these things. Does any of these things ring a bell? Leaking urine when coughing, sneezing, running or laughing? How about failing to reach the toilet in time? How about passing wind from either the anus or the vagina? And yes, we're going to be using anatomical words this session when you're bending over or lifting. What about the fact that there might be a distinctive bulge at the vaginal opening? How about heaviness or dragging in the pelvis and your back? How about reoccurring urinary tract infections or recurrent thrush? Like, this is all a sign that there's a dysfunction happening, isn't that right, Lauren?
Yes, exactly. Yeah. And particularly with incontinence, I think a lot of people, and even prolapse, think that it's something that affects older people only. And I see a lot of pregnant and postnatal women. And so these conditions are happening for people of all ages. I see 25-year-old women that might have just had a baby and they're experiencing these issues. And fortunately, they are obviously seeing me, but there's a lot of people that go under the radar that just get put in there, oh, this is normal, you've just had a baby.
Yeah.
And it's not. Like, yeah, it's a common thing, but it's not a normal thing. So incontinence in itself is really common. So 1 in 4 Australians experience a form of incontinence, and that can be urinary incontinence or bowel incontinence. And I think bowel incontinence, as we were discussing, Loretta, is even more taboo than urinary incontinence.
Yeah,
and
for sure.
It's not discussed, it's not addressed, it's sort of put aside, don't talk about it. And again, it can affect younger women and men, of course, as well. The stats of fecal or bowel incontinence are reasonably high. So with females, we notice that there are up to 10% of women are experiencing fecal incontinence. So it's a reasonably high stat, and that 6% of men are experiencing that.
And I'm glad you mentioned the guys, because this is a conversation. We all have pelvises. We all have pelvic floors. I actually confessed to Lauren that I Googled, do men have pelvic floors? And Larissa is laughing over there, because it's often seen as a women's issue, and, I'm having women's problems. I know that was the term that was used. Oh, such and such can't be involved because she's having women's issues. But pelvic floor, we all have one.
Yes.
And it is an issue. Larissa, what's your experience around this?
I did want to...
Sorry? Go again.
Hello. I did want to add to that. In how I see people coming in to the gym is often, like you said, post pregnancy, but even post 1, post 2, post 3 children, and now they're never recovered properly. And in our society, we don't encourage people to recuperate from pregnancy and the amount of nutrition that is required of the body to produce a baby. Our society doesn't nurture that. It doesn't allow the woman to recover, which is where we see the abdominal separation come back together, where we see the pelvic floor recover. In naturopathically, we encourage breastfeeding. Yes, I said breast. We encourage breastfeeding because it releases oxytocin, and that, alongside with pelvic floor contractions, as you would agree, helps the vagina and everything come back to its original form. If we miss out on breastfeeding for whatever reason, if the milk doesn't come down, it's not the mother's fault. But if we miss out on that, we also then too have to apply extra time to recovering the vaginal area, because it is quite traumatic, actually, delivery.
Oh, definitely. Yeah. And unfortunately, some people do experience more trauma than others with birth. And again, coming back into fecal incontinence and urinary incontinence, we know those that experience 3rd and 4th degree perineal tearing are at higher risk of developing these conditions. And a lot of women may sustain these injuries but aren't being told in hospital, this is what has happened and this is the treatment that you'll need ongoing. They unfortunately sometimes just get put back into the community and then develop these conditions where they could have been addressed from the start.
Yeah.
I think it's something that birth is obviously a huge topic, but it's something that it's like running a marathon. You spent 9 months building your body to doing this, and it needs that time to recover.
Yeah.
We're not just meant to bounce back to how we were before. It takes time.
Can I just add something about men that I wanted to say? Also, you're mentioning like pelvic disorders and things that might be signs, but also hernia is a sign that you're not using your core properly. And men may feel, their incontinence would be dribbles after they're trying to cease urination, but there's a few dribbles at the end, that sort of thing. And then when they're lifting heavy things and they get hernias, that's a sign that their pelvic floor isn't working properly either.
So there's lots... And I think that's why it's really important to have this conversation, because there's lots of evidence in our body. There's things that are happening in our body that, while they might be common, and I really liked how you said this, Lauren, it's common, but it's not normal. It's not how it's supposed to be. Isn't that right?
Yep.
And I think there's a lot of, taboo, and there's lots of people shying away from conversations. And it might only be when you're really with a group of girlfriends or a group of friends that someone might share that this is actually happening for them. And they're like, oh, really? Or, oh, that happened to me as well. And then we start to, build up this understanding of what else is happening there for people. When I was sharing with a person that I know, I said, I'm going to be talking about women's issues and health, particularly on the program. And I said, and she said, can you talk about bowel incontinence? And that's why one of the reasons why we're doing it today, because she said, I experience it. I know people who do, and people find that it's very isolating. Can you talk to us, Lauren, potentially about what the experience is like from your point of view of what limits them in life then?
Yeah, definitely. So bowel incontinence, is something that's so difficult for people to manage, and I think it affects their quality of life and their well-being. They tend not to go out; they'll stay home most of the time. They might have to quit their jobs because they can't physically be in the office when they're having to deal with pads and going to the toilet all the time. So that's a big thing. I think it impacts their exercise too, and we know that exercise is so important for all of us to be doing regularly. And when they're having these incontinence episodes that are happening sometimes with exercise, it's going to stop them from doing that. So I think the biggest thing is for them to know that it can be treated, and there are things we can do to reduce it or hopefully take it away so that they can be getting back into the community and exercising to help with their overall well-being as well.
That's really great. It's great to hear that there's things that can happen. And I'm not quite sure who's going to answer this question, my naturopathic friend or my physiotherapy friend here. Is bowel incontinence always mechanical, or is it sometimes maybe dietary?
I was just about to put my hand up and say, there's a large factor there that it's the end of your digestive system, and what goes in the start of that system can have a big effect on how it comes out the other end. So often you need to work hand in hand with, okay, is it a sphincter problem? Is it a pelvic floor problem? But is it a problem with the substrate that you're putting in? What's the food on your plate? But also, what's your microbiome like inside? Do you have parasitic, or have you been travelling recently? Giardia will certainly have you be bowel incontinent. So there's a lot of factors there, as you would agree. Definitely. But also in today's day and age, our fibre consumption is way down.
Right.
And in the past, our Paleolithic ancestors would eat about 100 grams of fibre a day, and our average Australian consumption's down under 20. So firm it up. It'll firm it up.
Exactly.
It'll give you something to hold onto,
Exactly. So, it's not always a mechanical thing. I think there's so many factors, and Larissa, touched on it perfectly, that it's a team approach. So physio might be part of it, but definitely dietitian, naturopath, your GP. There might be a colorectal doctor that specialises in these conditions as well, where we can get a whole management plan together to address, well, why is it happening, and how can we prevent it from being an ongoing thing. So fibre is a huge thing. Water intake, toilet mechanics are another one actually.
I'm glad you mentioned that. Okay, and I just want to put a little hold on the toilet mechanics because I want to get to that. But can we talk about constipation first? Because I think that there's that can be a contributing factor, can't it, for how we find ourselves later if we're having chronic constipation. Can you speak with that a little bit, Lauren?
Yeah, so constipation, there are different forms of constipation. So again, it can be a mechanical thing, which is to do with the pelvic floor. There's a pelvic floor muscle called your puborectalis that actually wraps around the rectum. And for some people, when they're going to the toilet, if they've chronically strained from a child ongoing, that muscle actually will contract when it should be relaxing for us to go to the toilet. So people will feel that they're straining and pushing, and that actually creates more of a kink and a contraction around the rectum, so then nothing will come out.
So all that hard work after all those years, you're actually doing yourself a massive disservice.
Exactly.
And you'll probably get hemorrhoids as well.
Yeah.
Exactly.
Okay.
So it's learning how to get those muscles to coordinate and work properly, but also the position of the pelvis and the muscles. So with constipation, so that can be the mechanical side of it. There can be dietary-related issues, obviously, as well. Some people can have what's called slow transit constipation, where it just takes longer for the food to get to the end. But the mechanics, is a big one. So our toilets that we have in the Western society are not very good for opening our bowels. That muscle in particular will contract more when our knees are lower than our hips.
Another reason to squat, people.
Yes, exactly. So
Do you recommend the squatty potty?
Yes, definitely.
Yes.
Yep.
We have a squatty potty at home. I will admit we're full-grown women. 39, I'm 38 this year, and my wife is 43, and we use a squatty potty. It's not just for kids.
No, everyone should use it, men and women as well.
Yes.
Okay, people are now rushing off to Google the squatty potty, but really what it does, it actually supports us to have our knees higher than our hips so that we're sitting in that sort of squatted position. And I think I've actually seen a diagram. The bowel loves that because it makes the bowel nice and elongated and more straight, doesn't it? So it actually, we're using gravity.
Exactly. And it's to do with that muscle again. So when those knees are elevated, that pelvic floor muscle will let go and it will relax and it will allow it just to naturally come down instead of us having to fight against that resistance.
So if someone came in to see you as a physiotherapist, what are you doing to support us? Say if it's urinary incontinence, say it's bowel incontinence, and fear not, folks, Lauren has agreed to come back and speak about a whole lot more stuff that happens in the pelvis, which is great because it's a massive topic. But we're just really looking at this incontinence piece today. What will you do? Like, I come in, I tell you, and I be very brave, and I share what's happening, and because it's really sometimes quite embarrassing. What do you do then? Is it just a conversation we're having? Are you doing an examination? What happens?
Yeah, so it varies depending on the patient, but making that appointment can be a big step for a lot of people. So just doing that is a really step forward. We have a big chat to start with. So our appointments are an hour, and I spend probably 30 minutes talking to people. So getting your history of, well, what are you coming in with today, but also what's happened in the past. We'll go through your dietary issues as well. So, what are you eating? What are you drinking? Is that contributing to what's happening? And then we would do an assessment. So that can be varied. It depends on the patient and what you are happy to do. Some of the time it does involve a pelvic floor assessment, and that can be done vaginally. So where we would look internally at the muscles and see if that's contributing to your issues. But that's not always something that we do at the first appointment or at all. That's something obviously that you have to consent to, and it's not always required, but it does give us a really good idea of what your pelvic floor muscles are doing. Because I think the other misconception with incontinence is that the muscles of the pelvic floor are weak and that they're not doing the right thing, which is most of the time, but sometimes the muscles can do the opposite. So where they get too tight and they don't relax properly, and that's what we call an overactive pelvic floor. But the treatment for that is very different. So if we've got a muscle that is really, really tight and we then want to do more contraction with it, it's going to make it worse. So that's where these appointments are so helpful, because it'll tell us what your muscles are doing and what the best treatment is for it.
Yeah, that's great, Lauren. And it sounds, Larissa, similar to the conversation we were having. Find a trusted professional that you can go and have a conversation with you're on the same page with, because you don't need to reduce your sporting activity. You don't need to reduce time outside the home just because of this incontinence issue.
That's right. And I think bringing up your word before, Loretta, the taboo around that groin area, especially... It's a common thing in my studio to be mentioning people's vaginas and men's anatomy and its location, because I tell you, if you want a man to contract his pelvic floor, you say the area between, your man bits and your bum hole, and no, it doesn't get it, and screw it, pull your nuts up. And bam, there it is, straight away, exactly what we want. So, everybody knows where it is, and we just need to deliver it with confidence. And that's the same thing, find a practitioner that you feel comfortable to talk to this stuff about. And if the practitioner skirts around the words and skirts around it and they're uneasy about it, you're not going to feel comfortable to discuss these things and take the treatment from the people. So definitely you have the power. You're the one consenting. You interview your practitioners and find one that suits you, because not all of them will.
Fantastic. So you've been chatting this morning with Larissa Watt, who is a clinical naturopath and strength and conditioning coach with Healthy Society. And also we've been joined by Lauren Earl. Thank you so much from Physio Pod. It's been really great to have you both. I know you're both going to come back at some stage. I'm going to hold you to that. And I really appreciate your time and your passion. Thanks, ladies.
Thank you.
Thank you.